For my presentation, we'll be discussing Addison's disease, otherwise known as primary adrenal insufficiency. Addison's disease is a disease of the adrenal glands located on each kidney that can't produce enough of the adrenal hormones such as aldosterone and cortisol. This disease is a problem with the adrenal gland functioning and its inability to maintain homeostasis within the body. There's also secondary and tertiary adrenal insufficiency, but here we will discuss primary, which is also called Addison's disease. Addison's disease can be acute or chronic, but it is life-threatening, and prompt diagnosis and management are essential. Addison's disease is difficult to diagnose because symptoms come on slowly and can be confused with other illnesses. These symptoms include chronic or long-lasting fatigue, muscle weakness, loss of appetite, weight loss, abdominal pain, nausea, vomiting, diarrhea, low blood pressure that drops further when you stand up. That could also cause dizziness or fainting, irritability and depression, joint pain, craving salty foods, hypoglycemia, which is also called low blood glucose, irregular or no menstrual periods, low libido, and skin discoloration, like a darkening of the skin. When an illness or a stressful event triggers symptoms to worsen acutely, it is called a Addisonian crisis, which is a medical emergency, and that is when blood pressure is very low and the person is very dehydrated and there's an imbalance of sodium and potassium. Possible causes of Addison's disease include autoimmune destruction of the healthy adrenal tissues stimulated by an autoimmune disease. Antibodies like anti-21 hydroxylase are found in the blood of 86% of Addison's disease patients. Long-term treatment with medications that interfere with normal pituitary function, an abnormal growth or tumor in the pituitary or hypothalamus, deficiencies in ACTH and possible other pituitary hormones, previous radiation to the pituitary gland, and when Thomas Addison described the disease that now bears his name, bilateral adrenal destruction via tuberculosis was its most common cause, meaning that tuberculosis virus moved down from the lungs into the adrenal cortex, causing damage. And those under 20 years old diagnosed with Addison's disease, 70% are male, while those over 30 diagnosed are predominantly female at 80%. And it's unknown why there's this kind of division in age diagnosis. The adrenal gland is divided into layers. Within the outer layer of the cortex is the zona glomerulosa, the zona fasciculata, and the zona reticularis. And the most interior layer is called the medulla. The zona glomerulosa is where aldosterone is made. Aldosterone decreases potassium, increases sodium, and also increases blood volume and pressure. Various factors, including low blood pressure, sodium levels, or decreased blood volume, causes the enzyme renin to be secreted. Renin is secreted from specialized cells in the afferent arteriole of the glomerulus within the kidney. These elevated renin levels set off the renin-angiotensin aldosterone system, which triggers aldosterone to be secreted. Aldosterone binds to receptors on the specific area of the nephron within the kidney called the distal convoluted tubule. Aldosterone stimulates the sodium-potassium pump to drive potassium out of the blood and into the cells, slowing down its concentration gradient. into the tubule where it will then be excreted as urine. The pump also drives sodium out of the cell and into the blood with water, which makes the blood volume and pressure increase. Aldosterone can also have an effect on blood pH levels by stimulating the ATPase pumps, which cause more protons to be excreted into the urine. When the negatively charged bicarbonate ion is moved into extracellular space, pH increases. For someone with Addison's disease, low aldosterone level causes potassium to rise and sodium levels to fall in the blood, causing water to move out of the blood vessels, leading to low blood volume and low blood pressure. More protons build up in the blood, which creates acidosis as well. The cells of the adrenal cortex that secrete cortisol are within the zona fasciculata. Cortisol secretion is regulated by the hypothalamus, where things like time of day, fasting or fed state, and stress are measured. The hypothalamus measures how much cortisol should be in the blood based on this monitoring by releasing corticotropin-releasing hormone. This hormone then goes to the pituitary gland, which sends out adrenocorticotropic hormone, ACTH, that travels through the bloodstream to the zona fasciculata, which signals cells to release cortisol. Among its many other important functions, in reference to Addison's disease, cortisol is important because of its role in gluconeogenesis, the creation of new glucose molecules within the liver. Likewise, cortisol helps break down proteins and adipose tissues into amino acids and free fatty acids, which provide materials for these new glucose molecules. For someone with Addison's disease, the lack of cortisol in a stress response can lead them to feel tired and weak. The low cortisol levels can also lead to an overactive pituitary gland, which can influence the hormone which is responsible for skin pigment production, resulting in hyperpigmentation. Androgens produced in the adrenal cortex are also affected by Addison's disease, which affects sex hormone balance. To diagnose Addison's disease, a doctor will ask about symptoms and if there's anyone related to the patient with an autoimmune disorder. The doctor will observe if there is hyperpigmentation, discoloration present of the skin, and test for low blood pressure. If Addison's disease is a possibility, more tests will be ordered to check on sodium, potassium, and cortisol levels. An endocrinologist would also test for aldosterone levels, ACTH levels, glucose levels, adrenal antibodies, and do a test where they administer a synthetic ACTH to see if cortisol and aldosterone levels react. Treatment for Addison's disease includes hormone replacement therapy, like taking hydrocortisone to make up for low cortisol, and fludrocortisone to make up for low aldosterone. Since Addison's disease is chronic, these medications need to be taken for life. With this medication, people with Addison's disease can live healthy, normal lives, but need continuous monitoring as the balance of this hormone treatment continuously fluctuates over time.